Hi, and welcome to another episode of Relationship Talk with Laura. Today we are in our Hollywood studios, and I have a special guest with me today, Sommer Larios. Today we are going to be talking about a wild card in marriage. What on earth is a wild card in marriage or a relationship with other people? Well, it's very simple. A wild card can be something such as suddenly having an accident and ending up as a quadriplegic in a wheelchair. Who would have ever guessed that that could happen in a relationship? Today, the wild card that we are specifically talking about is chronic illness. The one we want to focus on today is fibromyalgia. And Sommer Larios is here to talk about it because that is what she deals with every day of her life. Welcome, Sommer. I'm so happy to have you here.
Thank you, Laura. Thank you for having me.
Can you please, first of all, tell our audience what on earth is fibromyalgia?
Well, that's a pretty complicated question just because nobody really knows what it is. But basically, it's widespread pain for no reason. There's lots of theories about what causes it, from kidney issues to autoimmune disease. And some people think it's a made-up condition and that it's psychosomatic, or there's not actually a problem, you're just making it up, like a hypochondriac. So that's the fundamentals of fibromyalgia.
I would think that that would be very difficult for you. Can you tell us what the history is so that the people out there can understand? How did you end up with this illness? How did it occur? What did doctors tell you?
I don't know exactly how I ended up with it. A lot of the research that I've done says that it can be brought on by a stressful incident. I don't have anything particularly like a huge stressful incident that I can recall, but it was my last 2 years of college. I was dealing with a lot of pain and also chronic fatigue, which is a symptom of fibromyalgia. And I kept going to the doctor. They kept prescribing me different medications, and probably about 6 months after working with a doctor, he finally said, "Oh, I guess you have fibromyalgia." And it was sort of like, I've tried everything I can, and now I'm giving up on you, because it's not a death sentence, but it's I've done everything I can, and now just leave. I mean, he was nice about it, but it felt kind of like that, where it was I can't do anything else for you, and science has gone as far as it can, and there's no help left for you. So it was really difficult. Plus, I still had the pain and the chronic fatigue and still trying to deal with life. So it was really difficult for me.
So you said that it was like a death sentence. Is there no cure for fibromyalgia?
No, I mean, they don't even know what causes it. So there is no cure. They do have some medications that supposedly lessen the symptoms. However, there's no getting rid of it. It doesn't get progressively worse over time to the point that you'll die, but it's chronic, so it's never going to go away. And for some people, it does get worse over time, not to the point of death, but just gradually worse.
So you said that sometimes they think that it's psychosomatic. Did you have some doctors that thought that you were just making up the symptoms?
Yeah, I've had doctors tell me that they wouldn't treat me, that just flat out, I don't treat people with fibromyalgia, which seems kind of weird coming from a doctor, because they're supposed to treat everybody. Yeah, and others just think some people think it's like a form of, or a result of being hypochondriac, and I think for doctors it's hard if they if you can't do a blood test or a skin test or some kind of a test that has a result that definitively says you have this problem. It's like they can't see anything other than that. If they don't see a result, because anybody can come in and say I have pain, but if your leg's not broken or sprained, or they can't x-ray it and they can't see it, then there's no way for them to understand it or to try to figure it out. And so I think for some doctors that's a no-go for them. If they can't see it, touch it, feel it, or test for it in some way, then either you don't have a problem, or it's a problem they won't even try or can't even try to help you with.
Now, do you have any stories about doctors that you want to share with us that?
Yeah, I unfortunately have had lots of bad experiences with doctors. They're not always my favorite people. But one in particular, I had insurance with an HMO, so I got a referral to go to doctors that work with autoimmune diseases and arthritis. And so I went and visited him, and he's basically said, he did the test for fibromyalgia, which is basically they poke you in about 20, 24 different places, and if it hurts in 18 of them, then you have fibromyalgia. So it's fairly unpleasant just having someone poke you and it hurts.
Sure.
And not the most scientific of
Yeah,
of ways to diagnose. But so he did that and confirmed that I did have fibromyalgia, and basically said, I'm the only doctor on the whole, east side of LA, so I don't have time to take care of you. Basically intimating that I have other clients or other patients that I can help, and too many of them. So I'll just tell your primary care doctor how to help you. Which, if he did, I never heard anything. And then basically said, so you're depressed, right? Yeah, you're depressed. So you need to, exercise and do this or that. And then like a minute later, he's like, okay, so in summary, you have fibromyalgia, you're depressed, and you should exercise. And then sent me on my way. And it was just so dismissive and ridiculous, and I only paid, like a $10 copay, but I felt that I'd been ripped off still, because it was, just emotionally damaging more than anything, because you want to try to get some help, or another thing that it's really difficult for me is sometimes certain pain medications will help, but they don't want people to become dependent on drugs. And so I feel like if you have a back problem or anything like that, then they'll give you pain medicine, or they'll give you, especially if they think that it's if it's not chronic. But if I ask for something, then it's like, no, you can't have that. And so I feel like, so you're not going to help me manage it, and you're not going to treat me at all. So why are other people worthy? And I don't want to become a drug addict. And when I do get something like hydrocodone, like I hold on to it and use it only when the pain is absolutely at the worst, because it is really hard to get, and it's really hard for people to understand that I'm not a drug addict. I'm not trying to get prescription pain medicine for anything other than sometimes I just need it to get through the day. And so that and that was one of the doctors who was like, no, that's the worst thing you could do. And I was like, really? Because every once in a while it helps. So he just felt so out of touch and so dismissive, and the one thing he could have done for me, he refused. And so it was probably the worst experience I've had with a doctor.
Okay, now because this is a relationship show, tell us about your marriage. You're married, and tell us about how you broke it to your fiance, first of all, that you had fibromyalgia.
Well, it's pretty easy to break to people because they have no idea what it is. It's not like telling somebody you have cancer and they're like, oh my gosh, and they'll freak out. But with fibromyalgia, people are like, fibro what? And my husband's English is a second language, and he still can't say fibromyalgia because it's kind of a tongue twister. but yeah, so he was just like, okay. I could have told him that I had a cavity, and he probably would have reacted the same. Just and that's a response with if someone doesn't have it or doesn't know somebody that has it, they're like, oh, it's again like saying, oh, I have a sliver, or the impact is the same. So it wasn't really hard to break it to him. It is very difficult to explain to people, because again, if you if you have diabetes, almost everybody knows somebody with diabetes or knows about it, and so they're like, oh, do you have to take shots? Or they're familiar with it and how it disrupts your life and how it can be painful, or or a lot of people are like, oh, you can't have sugar, that's what sticks in people's minds. But with fibromyalgia, it's hard to be like, well, I have pain for no reason, and they're like, that just doesn't really mean anything to people. And so I think I still have to explain to my husband, because I don't think he always understands what exactly it means. And sometimes he'll be like, my back hurts. I have what's that called again? And he's like, yeah, I have fibromyalgia. I'm like, no, you don't. It's not every time you get an ache. Does it mean you have, like, so he's a little dense in that area.
Okay.
So,
Okay.
but I mean, I think for most people, it is just really hard to understand, you know? If you don't know about it, you don't know somebody with it, you know, and if you don't have a test or like, yeah, you know, the doctor said I have this disease, and even though if it's something someone can't see, like cancer, people have heard about it, people know someone who's died from it, you know, so it's really hard to explain to people, you know, especially my husband, that it's not just like, I like to sleep too much, and so that's just my problem that I need to get over with, you know. It is very difficult to explain to people that. I think that's the hardest part for me in any relationship, especially with my husband.
So, all right, so you get married, your husband knows you have it, but how does the actual illness affect your marriage?
Sometimes it's hard. He's young and likes to play, and he'll hit, not hard, but he likes to like tap my arm or shake, or, you know, bury his head in my arm, and my other arms get sore a lot. And so what most people probably wouldn't even feel is very painful for me. And so again, that's hard for him. Like, he thinks I'm exaggerating or being a baby, and, you know, he grew up with a brother and I'm a girl, and so he's like, you're just, you know, you're being a baby, just stop. I'm like, no, it really hurts. And so when I try to get him to understand, but he, again, like if someone has a big bruise or a big sore or something, and you remember like, oh, don't touch that, and it's for a limited time, but constantly to be like, oh, I can't touch you because it hurts, and like there's kind of no reminder there. And so for him, it's hard to remember, like, oh, don't grab her arms, or like, and not that he like beats on me, I don't want it to sound like that, but you know, just tapping my arm. I mean, even
he likes affectionate play.
my sister one time kind of just did like a little backhanded tap, like, oh, because she was excited, and I like turned around because I didn't realize why she was like punching me, and then I realized she was just excited. And so it's little things like that where for most people it's just simple contact, but for me, especially when it's bad, it's like I want to go cry because I feel like I just got beat up. So I think, and it's, and I don't want to fault people, like everyone's horrible and refuses to understand me, you know, because it is hard to remember. Like if you have a sunburn and people keep touching you and they're like, oh, I forgot, you know, I mean, it's because it's just human contact, it's just small things, you know, like whose arms just hurt all the time.
Right.
You know, it's so weird and not something that you're familiar with. And so like I said, just normal contact, or like my sister just kind of like backhanded because she was excited, not really hard or anything, and until I turned around and realized it was because she was excited. I was like, why are you like punching me? Like, what's wrong? You know? And sometimes with my husband, where I'm like, you know, you have to be gentle.
Okay, I'm going to ask you kind of a personal question, and I'm sure that the studio audience is really wondering about this, or the internet audience out there, and that is, how does that affect your private, intimate relationships with your husband?
You know, it's usually not a big deal. When I'm in a lot of pain, or, you know, just imagine if you have like a really long day and you have a really bad headache, you know, you just want to go home and go to bed. But, you know, if you don't have, you know, when the pain's not really that bad, or it's abated for the most part, then you know, it's not a big deal. So it doesn't limit me excessively in any area like that.
So the pain, what I'm hearing is that the pain comes and goes. Do you want to describe that?
You know, it's really different for everybody, but I'm always tender in certain areas, so it's not constant pain, but in certain areas, if anyone touches there, like my arms or around my knees or my hips, I'm always very tender there, but it doesn't always like necessarily like, it's not always necessarily in pain. And the pain is more cyclical, where sometimes when I go to bed at night, like my leg is just throbbing and feels like, you know, 10 people were just punching on it all day long. But that goes in cycles. And also sometimes like when I'm in stress, that seems to aggravate it even more. And so there is, you know, a psychosomatic, for me at least, aspect to it. And sometimes it comes and there's nothing going on. So it's, you know, if I could just meditate all the time and not get it, then
If you could be a monk.
yeah, I still think I'd have it though. And really, the worst part for me, the pain is bad, and I obviously dislike that. But the chronic fatigue is the worst part for me. It causes a lot of depression. Feeling tired and being in pain feels like depression. Plus, it's just depressing to be tired all the time. So, and people don't understand that. People think that I'm just lazy. Most people don't say that to my face. But I feel lazy because I'm so tired, and I slept 10 hours last night, and I'm still, taking a nap in the afternoon. Like I just feel unproductive. And it doesn't go over well at work, obviously. So that's, yeah, besides the physical things that the pain and the tiredness, but besides that, or on top of that, there is sort of like the social aspect to it that just compounds it.
Okay, so let's go down with each one. First of all, I want you to tell husbands out there what do they need to know, and how can they be more loving and kind to their spouse who might have fibromyalgia or another chronic illness?
I think with anything in marriage, just being patient and listening. If you want to choose not to believe, then that's obviously an issue. But if you truly do believe that they have fibromyalgia, then you're going to try and work with them. And when they tell you, I'm in a lot of pain today, then you'll, be wary of that, and you'll try to understand that. I think with anything, from my very limited experience, I've only been married a year and a half, but just trying to be patient and trying to understand, and empathy, not sympathy and pity, like, oh, I feel so sorry for you, but just really trying to understand what they're going through will help you be a little bit more patient and a little bit more understanding. And obviously not saying like, oh, don't be so lazy, like get up out of bed today, like that, that just really hurts coming from a loved one when you're really trying, and sometimes you already feel like a failure of like a wife or a mother, because there's so many things that you should or could be doing, but you just can't, and there's sort of a higher level of self-preservation, because sometimes you are so limited in what you can do. And even though it may be hard on the outside to try to be supportive of that, because you may feel like you're not doing anything, but to be supportive and to be loving and just try to be understanding. And I think that understanding goes a really long way, for me at least, when my husband, lets me sleep in and doesn't bother me, and does, extra work around the house. Like, that means a lot to me, because, in addition to it being done, it's also just sort of a pat on the back, like, I'm here with you, I want to help you, I can't take the pain away, but I'll do what I can. And I think, and that's with anything in marriage, but I can imagine it must at certain times be really hard to be patient and to feel like, oh, you're not pulling your weight. But just consider, if they had a disease that, like cancer or something, how would you be like, oh, you're being lazy, you had chemo, like get out of bed. You would never ever say that. And so I just, again, I've said it 5 times, but just be patient and understanding, and show love in any way that you can, and it'll go a long way to helping emotionally. I think any woman, your wife, that's suffering from fibromyalgia, I think that to me is what means the most to me.
So what we've been talking about here is that, number one, I think, believe that your wife does have fibromyalgia. And just like Sommer is saying, if she had cancer, you would never question her and say, oh, that's psychosomatic, you don't have cancer. I think it's really critical that you first of all believe that she has that illness. And even though it's such a complex one, when she has to stay in bed, when she's tired, that you give her love and understanding. And the way that translates is into action. And that action is by allowing her to sleep in and saying something like, oh, honey, I know you're tired. Please sleep. Don't worry about it. And then do extra chores. I'll take care of my own dinner. I'll take care of my own breakfast. I'll take care of vacuuming today. You sleep in, well, it isn't sleeping in really, it's you get the right amount of sleep that you need. You take a nap if that's what you need. And think of it in your mind like Sommer's great analogy, which is if she had just come home from chemotherapy, you wouldn't say, get up out of that bed and make me dinner. You wouldn't even think that for 1 second. And the same thing is true with this, is that it's translating that understanding and that love and that sympathy into actual action. And the action is by going ahead and doing the extra chores, doing the things that need to be done to help her. Let's talk about work for a second. So I am sure that it's very difficult for people with fibromyalgia to maintain a job. Do you want to talk about that?
Yes, it is. I'm currently not working, but I was a paralegal for about 7 years.
Wow.
And I'm going to school right now and not working. But a lot of fibromyalgics do not work well, I mean, I don't know what the percentage is, but most people that I hear about do not work. And I'm a fairly high functioning, even though I don't feel high functioning most of the time.
You look terrific.
But I'm a fairly high functioning fibromyalgic. But I do take a lot of sick days. You know, I do come in really tired, you know, getting up early, getting enough sleep. It is really difficult, and people don't understand, you know, if you call in sick to work and you don't have a cold, that's hard to understand. Or if you're like, oh, you know, I feel, you know, I always just say, oh, I feel under the weather. You know, that was sort of like my code for I want to die because my pain is, you know, so because again, people don't understand, and I don't go around work telling everybody what I have, you know, maybe that my closest of coworkers, you know, maybe I'll tell them, but I don't, you know, go into the office manager and tell them that I have a debilitating condition.
Right.
So that is really hard. Plus, you know, because of the pain and the fatigue, you know, you get up in the morning, you go to work, you come home, I'm exhausted, and then I just go to bed. Like maybe I'll do, you know, watch TV or do something else for a while, and then I just go to bed. So you know, I'm up early and in bed early. So when it's really bad like that and I get in that cycle, it's so hard because that's your entire life is just basically trying to get out of bed and stay awake long enough to work 8 hours. And so that can be, you know, very crushing emotionally, just when all you're doing is work. And you still have no energy, you know, you're trying to get as much sleep as possible. So, you know, that can be really hard. And it's not always like that, but sometimes for me, I kind of got into cycles where it was just awful, because you're not really living a life, you know, you're just getting up and staying awake long enough and trying to do your work the best that you can for 8 hours a day till you could go home and rest and sleep. And so for me, those were the worst points.
What do you recommend that a person say to their employer so that they can get some understanding? Because obviously you don't want to tell everyone in the office, hi, or wear a sign, I have fibromyalgia.
Yeah.
So what do you recommend that other sufferers from fibromyalgia say, or from chronic illness who have to work 8 hours a day? What do you recommend they tell their employer?
You know, that's really tough because it just depends. You know, our society is built on production. You know, if you're not doing something, and they can't necessarily fire you once they find that out, but you could be on the short list of people to let go if they had to let somebody go. So it is really difficult, and it depends on the relationship that you do have. But I mean, just telling them that you have a condition that sometimes causes you a lot of pain and makes you tired. You know, it's not, again, it's, you know, you're not telling people that you're about to die. You're not telling people that you're a huge health risk at work. It's not contagious. So depending on the kind of trust that you have in your employer, you know, if it's a really good company, it shouldn't be too difficult to, you know, let them know. If they notice you've had a lot of sick days, you know, but I mean, I almost used all my sick days, which you're allowed to do.
Sure.
Not a big deal,
Yeah.
you know, and then suffered through the rest. So it's just, it's kind of a sticky situation. There's not a whole lot to do. You just try to find the most friendly environment that you can. So, I don't really have any great advice for that one. I haven't quite figured it out myself.
That's okay. So one more thing, and that's how to deal with depression, because I'm sure that husbands could really help a lot with their wives, so that they aren't depressed over the condition that they have. And perhaps you can also give us some advice on how you yourself can deal with depression in the next 3 minutes.
I think first having a good therapist. That's what's helped me the most. And I'm a little biased. I'm going to school to become a therapist. But I think that's helped me the most, because somebody that can really show you empathy and help give you a reality check, because it's so easy to get down on yourself and think of all the things that you're not able to do, that you're not doing that you should. You're not as good in your job or as far along as you'd like to be. You're not as good a wife as you'd like to be. You're not as good of a friend. There's so many ways to get down on yourself, and so many ways that you feel like you're failing, or you probably, maybe are failing or not doing as well as other people because you just can't. And so I think, seeing a therapist or just trying to do the reality checks on your own, and that's something that husbands can help with. And again, being supportive and saying, you're not running a marathon tomorrow, and that's okay. I think that, because the depression is, for me, a big part of it, because it's so easy to get down on yourself when nothing's wrong, and when you have something that's just really stopping you from doing all these things that you would like to do. If I could stay awake for 14 hours at a time, that would be so amazing, and I'd get so many things done. I wouldn't just lay around the house. So it is hard to have these limitations and to not let it become who you are.
I like what she just said of don't let fibromyalgia or any other chronic illness that you have be the definition of who you are. If you could run a marathon, you would tomorrow. So to all of you spouses out there who may be dealing with a wild card in your relationship, remember that you want to be a cheerleader for your spouse. And you want to say, don't worry, honey, just like Sommer said, you're not running a marathon tomorrow. You just be the best person you can for who you are. And by emphasizing the good that your spouse does, Sommer is a great example of this. She has such a beautiful face, and she's cheerful, even though she's hurting inside. And so that's something that her husband could focus on, is how cheerful she is, and that he's so grateful that he has a wife like her. And it's the same thing with you. You look at who your spouse is, and you're grateful for who and what they are, and you tell them those things. And lastly, think of it as this is one of your missions in life. After all, we get married, we have a relationship to help our spouse become the very best person that they can be, and to achieve their mission in life. And part of our mission is to see to it that they do that. And that also means then that if they have a chronic illness, then that's part of our mission in life, to make their life better, to be their cheerleader, to give them love, understanding, and help more around the house. Because that's who and what we are. That's what a commitment is in a relationship. That's what loyalty is in a relationship. And so we wish all of you out there the best if you are dealing with chronic illness, or if your spouse has chronic illness, or the major person in your life has chronic illness. Make it your mission to give them empathy, to give them love. We wish you the best. Here at Relationship Talk with Laura, we are changing one relationship at a time, making the world a better place. And thank you, Sommer, so much for joining us today. Until next week, goodbye.